lymphatic filariasis, or lymphedema, or lymphantiasis, or Hathi Pav in Hindi, or Manthrogam in Malayalam is a dreaded, neglected tropical disease. The patients of this disease are in millions, and they have been suffering the physical, social, and psychological impacts of it with virtually no cure available to them across the world for far too long. But not anymore. Dr. S.R. Narahari and his team at the Institute of Applied Dermatology have developed a unique treatment protocol based on Ayurveda, yoga, and allopathy. Using this innovative integrative medicine approach, Dr. Narahari and his team have successfully treated over 5,000 patients thus far. The testimonials of relieved patients, the documentary evidence, and over 70 research publications in international scientific journals speak volumes about the efficacy and effectiveness of this treatment protocol. As of today, this is the only effective treatment protocol available to lymphatic filariasis patients across the world. This video captures the major processes of this unique treatment protocol. IAD's Integrative Medicine Full Treatment Protocol for treating lymphatic filariasis. In the initial screening stage, the patients will be counseled on the many aspects of the disease and the treatment protocol. Then, the patient will be examined for any active infection. The limb will be measured with an inch tape and by water displacement method to gauge the baseline limb volume. The measurements will also be recorded later to check on the progress of the treatment. The next step is preparing the patient for the main line of treatment. This involves removing excess hair from the limb using a trimmer to prevent infections on the hair follicle during the treatment process. The nails are also trimmed and all accessories such as rings and bangles are taken off to prevent injuries. Now the patient is ready for the main treatment procedure. The first procedure is limb wash. Apply soap onto the palm first and make thick foam by rubbing both the palms. Apply the soap foam over the skin and in between skin folds. Wash away the soap foam with lukewarm water. Always use the same brand soap. Dry the limb with a soft cotton cloth. Limb wash is important to prevent filarial fever, which occurs due to infections. After limb wash, the patient undergoes the Fanta soaking procedure. Fanta is a herbal decoction prepared 12 hours in advance. To prepare the Fanta decoction, boil water in a container. Once the water is boiled, switch off the gas and add the prescribed herbal powder in that boiled water. Stir it well. Close the lid of the container. After 12 hours, pour this Fanta decoction over the limb for about 20 minutes. Dry the limb with soft cotton cloth. Fanta soaking will improve the texture and color of the skin. It also helps to heal the tiny wounds. The next procedure is ointment application. If the patient has eczema or dry inflamed skin, apply the prescribed ointment in thick concentric layers. Cover the area with thin plastic and compression bandages for about 20 minutes for better absorption. If the patient has fungal infection, in between the toes, sprinkle the prescribed herbal powder for faster healing. The patient may do pre-yoga exercises as advised by the yoga instructor. The next procedure is IMLD, or Indian Manual Lymph Drainage. In the IMLD process, palpate the pulse in the inguinal region and massage in clockwise direction for about 6 times for facilitating drainage from the inguinal lymph node. Then palpate the pulse behind the knee and massage again for about 6 times in clockwise direction for drainage from the popliteal lymph node. After this, apply the prescribed Ayurvedic oil and massage the limb. Massaging is done in the upward direction, that is, from the foot to the groin area. This will help in the peripheral lymph drainage. Do the massage with breath coordination for about 20 minutes. Wipe out the excess oil. The final procedure is compression. Use cold cure foam or sponge covered with gauze and place between skin folds. Then layer this with soft cotton cloth or ribbed cotton stockinette. Start tying your bandage from foot to upwards in a figure of 8 method. Each person's limb size is unique, and thus the tying style varies from patient to patient. The patient can walk around for a few minutes, then do the post-yoga exercises. The patient must wear proper comfortable footwear which will not disturb the bandage. Diet and yoga are customized for each patient by the professionals. Patients are once again educated about the disease and the treatment protocols through education classes conducted after the treatment every day. To get detailed knowledge about the do's and don'ts of each step, do watch the separate videos of each step.